Hi, I'm Selena and I'm from Pain-Free Physiotherapy in Line Health. Do you have a migraine headache at the back, on the top, or around your eyes areas? Do you have a headache that keeps bothering you almost all day long? Does your headache sometimes get so bad that it affects you from doing your work and affects your sleep? And in severe case, you just want to hide in a dark room? Or do you keep taking painkillers because you have headache? If you have any of these, you should check if your headache is caused by your neck. Headache from a neck origin, known as cervicogenic headache, is a very common type of headache. Cervical means the neck area. It is a headache that is usually said to be caused by problem from the neck. This is because the information that we received from the frontal area of our head and the information that we receive from the upper part of our neck shares a common stop on their way to our higher cortex for them to be processed. Since the higher cortex cannot differentiate the information, it will send pain as an output to both our frontal area as well as our neck area, even though this part there has no problem at all. Therefore, the headache can be perceived anywhere, even though the cause might be in the neck. However, the cervical region is not the only location or the root cause that can cause headache. It can be from other body parts as well. For example, the shoulder, the jaw, and the back. Poor posture can lead to headache. For example, if you or your child has a slumped, poor sitting posture, your neck muscle can get tight. It can cause headache as well. There are two ends of the spectrum of headache: cervicogenic headache, which is more musculoskeletal related, and the migraine headache, which is a more severe form of headache that is related to blood vessel. Depends on your condition and where you position in the spectrum, your pain can be anywhere. It can be in the head, in the neck, around your eyes area, and it may even side shift between your left and your right side. Other than that, you may also experience a reduction in your neck range of motion. Most of the time, doctors will just get you to take medication, which will just mask the symptoms without addressing the root cause. And sometimes they may even get you to get some sort of imaging, such as MRI, ultrasound, or X-ray, that don't usually show much. There are some predictors to good outcome. Number one is when your symptoms doesn't side shift, which means it only stays on one side. Number two is if we can reproduce and reduce your headache intensity without hands-on treatment. At Pain-Free Physio, we use a holistic approach to assess your body as a whole and treat your symptoms. We perform a head-to-toe examination to look for all contributing factors and to determine the nature of your headache. Depends on your presentations, we will tell you our predicted success rate, then treat your root cause thoroughly. For example, by asking you to write a headache diary, give you advice and educations, provide manual therapy, and teach you exercises to do at home. Let me show you an example of a manual therapy assessment technique that we do on people with headaches.
Palpate C2. Okay, so the little finger, my little finger hook over C2, and then just cradle his head. Okay, I want it to be a little bit close to the patient with my body. If I'm too far, then it's not good for my back and it's harder to control. So get close to the body. Okay, the patient lean against the backrest of the chair. So for me, I just use this part here, just provide a gentle push. Okay, and then I'll glide patient's head posteriorly. So that is to push the C2 forward, okay, create a C2 anterior translation. Okay, by pushing the occiput posteriorly, just So that's the headache snag. If we do this correctly, and then the patient's headache reduce or disappear, okay, that's a good indication that this technique is working. You can hold it for 10 seconds and then let go.
If you present with a reduced range turning your head to the sides, then we'll do another manual therapy technique to help.
So right side is a problem. He's got a reduction in his upper cervical rotation to the right side. So we wanted to do a C12 snag to the right, a C12 snag to the right. So find the earlobe and then just come across where you meet the hairline. You can put your hand down the arch area of the C1. Okay. So you want him to rotate to the right. So you make your contact with your right thumb. Okay. And then the left thumb just reinforce, push it slightly PA. Make sure that you don't shuffle the patient's head forward. Okay. Just a gentle pressure. And even my other fingers provides us a gentle counter pressure so that his head doesn't get shuffled forward. You want to stand where you want to finish, so gently push, okay, and then he turn. And then remember the facet orientation of upper cervical spine is forward. Okay, it's forward, so you wanted to push horizontally forward. Okay, again, okay, turn to the right. Okay, and then if there's no pain, then you get the patient to use the hand to overpress. So left hand, make sure that the pressure is applied on the temporal area, so not below the TMJ. Okay, otherwise it's just stressing the TMJ. Okay.
If you have headache, feel free to talk to us and we'll be happy to answer your questions and tell you what we can do to help.